This is nursing care of the child with an infectious or communicable disorder. So people talk about the chain of infection. This means all of these have to be there for someone to get ill. And if you can break this chain at any point, you can stop illness. So there has to be an infectious agent, a germ, virus or bacteria, parasite, whatever. It has to have a reservoir. So it has to be somewhere. Often that's in our patients. It comes, there has to be a portal of exit. It has to get out of the infected person through a cough, a sneeze, through diarrhea. A means of transmission. So somehow it gets from them to you. Some things float in the air and you breathe them in. Not that many. Many are fecal oral. So it comes out of them and you have to ingest it. So somehow it's transmitted to that portal of entry. And for most of us, or for most germs, that is mouth, nose, eyes, that it somehow gets into us. Our skin is really good at preventing infection. It's only where we have cuts or breaks in the skin. So most things get in through mouth, nose, eyes. And then you have to have a susceptible host. You get exposed to things that you don't catch. So either your immune system's really good and able to fight it off, or you just get such a low exposure that you don't get sick from it. And on that chain of infection, we cannot stop germs from coming out of kids. They just do, right? Kids cough without covering their mouths. If they need to vomit, it just comes. So we can't stop the portal of exit. So what we need to stop is that portal of entry. Don't let it get into you. And how do we do that? Good hand hygiene. Hand washing, hand gel. Valley Children's uses gel in, gel out. Every time you go in a room, you gel. Every time you come out, you gel. Even if you're going to wash with soap and water, you do that first. Our C. difficile patients, and then you gel as you come out, even though you had just washed. We put people into isolation. So everybody is on standard precautions. That means if you're going to come in contact with any body fluid, you have gloves on if it's likely to get on your hands. You have a gown on if it's likely to get on your clothing. You have a mask on if it's likely to get in your nose or mouth. You have a face shield if it's likely to get into your eyes. That's standard precautions. Airborne is for things that are such small particles they can float a long way in the air. And this is where we have to have negative airflow. So when that door to the room is open, there's no chance of the germ coming out into the hallway. Air always is sucked from the hallway into the room. It never goes the other way. It also means you have to wear those N95 respirator masks. At Valley Children's, students won't be able to take care of these kids. There are not that many in general, so it's not like you're missing a lot of patients. Because they don't fit you for those masks. Those masks have to be fitted. Droplet is much more common. This is our colds and flus. This is things that come out when they cough, but they only go a few feet and drop. So you do have to wear a mask, though, because these are things that you catch by breathing them in, but you have to be within a few feet of the patient to get them. Contact means the germs can live on a surface for hours. Most of our kids you're going to see are contact and droplet. If you're close to them, you need a mask because you can catch from inhaling it, but the stuff comes out and sits on the counter, the bed rail. So everything you touch has germs on it. Now you have germs on your hand, or if you don't have a gown on, you have germs on your clothing, and you go in another room. So that's a very common combination to have both of those. How else do we prevent it? Immunization. A lot of our diseases can be prevented with proper immunization, proper handling and food preparation, and then judicious use of antibiotics, not overusing antibiotics. We have a lot of resistant germs because we've overused them when they weren't necessary. So when should you gel? Number one, before patient contact, we don't want to give patients what's on our hands. 2, before you do any task, an aseptic task on your patient. 3, if you've been exposed to a blood or body fluid, so something got on your hands, you need to immediately wash it off, and that's going to be soap and water, not just gel. After patient contact, as you're leaving the room, or 5, after contact with patient surroundings. If you're in a room, you should assume every surface in there has germs on it. So even if you didn't touch the patient, but you touched something in the room, you need to gel. So variations in pediatric anatomy and physiology that makes them prone to getting so many infections. An immature immune system. Being a neonate means you are immune suppressed. That just is part of it. So with that, newborns have a decreased inflammatory response. When you get germs into one place, you get a dirty, you fall and skin your knee and have a dirty cut, a dirty abrasion, your body's able to isolate those germs and keep them there because of that inflammatory reaction, right? You get the increased capillary permeability, kind of everything spreads out. The white blood cells can come out of the capillaries. You get some localized swelling. White blood cells come. That whole immune response to keep the germ there and have your immune system fight it there. Newborns don't do that. They do not isolate infection. So they get pneumonia, which gets picked up into the bloodstream, which turns into meningitis, or a UTI. Same thing. So they are not good at isolating infection because they don't have a good, their immune response is decreased. They also don't have as many antibodies. They just haven't been exposed to things. This is why kids get a lot of illnesses, and then when they start school, they get way more because suddenly they're exposed to all sorts of things they've never developed antibodies to. It's also why breastfed infants get sick a lot less because while they're breastfed, they're getting those antibodies from the mother. So an infant who's not breastfed is born with maternal antibodies but loses those, and then they are susceptible to those infections. And even infants who are getting their immunizations, most of our immunizations are at 2, 4, 6 months because the one shot is not adequate. So they may only be partially vaccinated against diseases just because of their age. So when you obtain a health history, you want to ask about exposure to infectious or communicable diseases. And we want to ask in the last month. Most of these have a pretty long incubation period. And people will think, well, where were we last weekend? No, where have you been in the last month? And has anybody broken out? Find out about their immunization history. If they've been immunized, that's not what it is. Or disease history. Many of these you can only get once. So if they've already had it, that's not what it is. Find out what the symptoms are. Did it have fever, sore throat, lethargy and malaise? Did it interfere with feeding, poor feeding or decreased appetite? Remember, kids are at high risk for dehydration, so we need to watch that. Vomiting and diarrhea. Again, we're worried about dehydration. Cough, rash, and if they have a rash, good description of that rash because that will really help the provider in deciding what they have. So some of the common treatments, hydration and fever reduction. Many of these are viral. All we're doing is treating symptoms. Our big problem, though, is if kids don't eat, they get dehydrated, and that can be very significant. So we want to encourage oral fluids. Fluids of choice. What do they like? Give them that as long as it's on their approved diet. If they are on IVs, make sure we're giving accurate, that if we had to calculate the rate, that's accurate, that what the pump says is what it should be. Just make sure that that's right. The policy at Valley Children's is that you check end to end on an IV every hour. So you check insertion site, tubing, rate on the pump, solution in the bag. You check everything every hour. Kids, if their IV infiltrates, it's not going to ring high pressure. because their skin's so soft and supple, it just stretches out. It's not going to give you high pressure till you have several hours of fluid in that extremity. And now it's very obvious that you have not been checking that IV, and the poor kid has a really bad infiltrate. Accurate INO. A lot of medical decisions are based on the INO. And people can be very sloppy with the INO. Don't do that. Be accurate on your INO, because it makes a difference of when the order comes through to stop the IV or to start the IV or to keep it running. So make sure those INOs are accurate. The other thing we're frequently treating with infectious diseases is fever. And parents tend to really overtreat fever. Fever is not that big of a problem. Kids tend to spike fevers higher and faster than adults, and they tolerate them much better. When an adult gets a fever of 101, they're miserable. When a kid gets a fever of 101, they're probably still playing and having a good time. Fever is part of how our immune system works. That is when we are really making antibodies. So we don't necessarily want to treat fever too quickly. So when we do, we want to make sure that we are dosing correctly. We're dosing based on weight, and no aspirin, especially in viral illnesses. Aspirin in viral illness has that risk of Reye syndrome, which causes permanent neurologic damage. So let's do non-pharmacologic methods as well. Dress them in light clothing with no blanket. Parents really like to do the tepid bath. That's rarely necessary, and you don't want it cold. You want it tepid, which is lukewarm. A cooling blanket, that's really only used at the hospital on kids where there's a neurologic problem causing this fever, not just a reaction to a infectious disease. But you will see that those exist. But those are both treatments that are not the first thing we should be doing. That's really only when antipyretics have not worked. Light clothing, maybe even a fan in the room has not worked. We do want to make sure we avoid shivering, though. Shivering is your body's increasing metabolism. It's making those muscles work. The byproduct from that metabolism is temperature. That's how your body raises your temperature, raises the fever. So if a child starts to shiver, then we need to put another blanket on them or turn that fan off. If an infant is less than 3 months and spikes a fever at all, it doesn't have to be high, they need to be seen, and they need to be seen right then. I mean, that's when you go to the emergency department, or at least call your physician and see if you can get in, but probably you're going to the emergency department. And this goes back to infants don't isolate infection. So a fever, a mild infection anywhere, if it's bacterial, it can travel into the bloodstream, turn into meningitis very quickly, and depending on the organism, a few hours can make the difference in what the outcome is. So some of the common laboratory tests we do in infectious diseases is that blood count, and we're looking not just is the white blood cell count raised, but which type of white blood cells, because that gives us a real clue if we're dealing with a virus where you have to let it run its course, just treat symptoms, or are we dealing with a bacteria where we're going to give antibiotics. ESR is your SED rate. That, at Valley Children's, you'll see they much prefer CRP. These are similar. They tell you your immune system has been turned on. We love CRP at Valley Children's. It works so much faster than watching your white blood cell count. I usually say CRP is like the light switch. It's off or it's on. It goes from normal to high in a matter of hours, where your blood count is more like the dimmer switch. You got to make those white blood cells, so it takes a little time for it to go up, and then once it's been up, they have their lifespan, and so it takes time for it to come down. Where the CRP, we get them on the right treatment, it comes down very fast. Cultures and sensitivity. This is how we identify the organism. You can do those stool, urine from a wound, from a throat.